are young, so you can grasp a lot of skills while you are there. Okay, the limitations basically of the PBPK or barriers is the lack of expertise. Very few people are working on PBPK model, and most of the time there is insufficient really knowledge and skills. Despite that, as I said, now it is a growing actually area, but still it needs a lot of refinement. As I said, you saw how hard the work it was. So to develop one model and to verify it, to make sure it is valid, it's a huge process. Insufficient data, I think this is everywhere. Inadequate data for validating the PBPK model, it's always recommended to have observed data. So whenever you are predicting something, you will be able to compare it and see how the predictions are really working very well. Software usability, a lot of softwares and programs are valuable, but to understand these softwares and how they are working, it requires training, it requires a lot of time. So you really need to spend time to understand how these softwares are working. We spend a lot of time to understand monoliths ourselves, and until it accepted the data, once we cleaned it out, it took really a while. So it requires really a lot more. Acceptance criteria, varying criteria across agencies and even countries. And as I said, really there is a lot of differences. There is a lot of things. So we cannot say that this model will work only in Asians or in Chinese. Or we have to try it out and we have to validate it before we say it works for everybody else because of the discrepancies and diversities. Okay, so I think this should be the take-home message. I'm not sure why it's being like that. So should we as researchers rely on PBPK model? What do you think? Huh? Should we rely on it? Can you raise your hands? Only a few people. I'm not sure whether they understand it or not. What do you think? Should we rely on it? Okay, those who say yes, why we should rely on it? The hand now. Why? I would say yes as well, but you will have to practice caution. You will have to practice caution because there is a lot of shortage of perspectives, examples verifying the clinical efficacy, as I said, discrepancies among the data. Make sure that the data you have validated your data or you have validated your model upon that. Make sure these data are actually reliable and they are sourceful. So don't use any data from anywhere. Because if you feed the software rubbish, it will give you rubbish. But if you feed it good data, you will get a good thing out of it. Alright? I think that's all. So these are the different references. By the way, what I'm putting here is very few. There is a lot, and try to explore it as much as you can. Thank you very much for your attention. Are there questions later or now? Right now? Okay.
With that, we conclude that Dr. Chokha has given us presentation. Please join me in giving a big round of
which are 3 months or 4 months projects. And as you mentioned, that some software can also be utilized for actually implementing it. Can you give some brief example where this project can be utilized, used by these people into their final year kind of course? Thank you.
So let me just understand from your question. So they have only a period of three to 4 months. Do you give them in advance what would be their project?
Yeah, probably they can be told in third year itself that they can be doing such kind of project in the final year. So maybe 2 and 3 months they have at their disposal. And if something like that can be utilized, I think it will not only value add to the knowledge but also enhance their skills.
I would think about 2 scenarios, but it really depends on whether you have the facilities to get data, for example, from health center. I don't know how does it work here, but if you are able to get the data and you have it already in your plate and you want to predict something out of it, as we have done, for example, in terms of the diagnosis, then that would be very easy if they already knows how to clean the data. And I think during the curriculum or during their development towards the end stage, there has to be some kind of methodology research, some kind of data analysis. I'm not sure how is your curriculum in that base, or at least you can direct them, because nowadays, to be honest, and comparing to my days, the internet is a very huge source. YouTube, name it. I mean, a lot of the Khan Academy, for example, itself, it has a lot of things there, and you can learn these skills in seconds nowadays, not compared to my days, for example. So during that, you can prepare the students by asking them to look into these different resources, and you can also test them while that. I mean, once you give them the data, you ask them, for example, to clean it, ask them to verify it, and try to use the software and practice and see if you can get something out of it. This is one scenario. The other scenario, since this country, mashallah, has a lot of pharmaceutical industry, I'm sure there is always a new drugs. So the industry can come to them, approach them, and ask them, can they run the simulation, for example, for them, in order to enhance the trial or the experiment? Because this is really very helpful. I mean, they can help you in designing the trial itself. They can help you in formulating the dosage form, for example, how much you can give, because it will give you everything about the parameters, PK parameters. You can also test it in the population that you want to test it, because some of the softwares are so developed that you can actually choose the population. Yes. Okay, so you have Monolix. It's a free simulation software. I'm not sure about PKSim. There is PKSim as well, and SimSim is not a free simulation software, but I think you can come into an agreement with them where they give license for academic institutions. So that is the role of these simulation softwares. I don't know if India, they have any softwares that are similar. I'm not aware of them. But maybe you can develop one by yourself, since you are very young now.
So may I know the cost of the software? What's the cost?
To be honest, I don't know. The Monolix is free. So Monolix is one of the valuable softwares. You can download it very easy, works on any format. But since it costs, the license is very costly. But I can't really remember, and I don't know if it increased or decreased now. So SimSim is one of the softwares. I used it myself, and it's really good. It's very developed and advanced.
Really, your lecture is wonderful. It's very, very useful for our body classes. Thank you.
Thank you very much. Again, thank you for hosting me, and I hope I inspired at least one person. One more question? Okay.
Good afternoon. First of all, I would like to say thank you, very good lecture for us. Madam, myself, I'm a dedicated professor of pharmacology and working as a principal in PBPK. Madam, my research area, as per behind this minimize the renal and liver toxicity through traditional system of medicine, especially usually Ayurveda, Unani, and homeopathy. Madam, can I use PBPK model in evaluation traditional drug to extract or directly plant in crude form.
I didn't get the question.
Madam, PBPK model can make use through evolution traditional system of medicine, especially agricultural or humanitarian system, herbs. Can we use this model through evolution? First, liver or
The only thing that I'm thinking about is, the data about that term. If we have it in terms of PK parameters and also the other things, the molecule exactly that works or it gives the pharmacological actions, if we are able to know about the parameters, these particular parameters, and you can fit them in the simulation software, I believe you can get something out of it. But if you are unable to find this data, and I know it hurts, it's a huge word. I don't want to even go there actually. But it's really very, as I said, if you worked on the parameters and you got it, then you can easily transfer it actually to the different population and you can figure out whether this particular drug will behave, I would say, it will behave normally compared to healthy subjects or it will behave differently actually in the different population. But the parameters are very important for the molecule itself or for the drug. Otherwise, you will not be able to get the absorption, the distribution, or these kinetics. Yeah.
thank you.
I hope I answered your question.
Yes, ma'am. Sure.
Dr. Zokha, you will give the very informative information about the kidney and about diseases and medicines. I want to ask one question because I am working in an endocrinologist since last 10 years. And the reference is basically unit of the kidney. Whatever should be nowadays research going on the medicine. What is the position of the research? It is going on the nanoparticles or the nuclear medicines. As you are the doctorate from the Manchester UK and you are going to MSc school also. So, what is the nowadays the position of the nuclear medicines? Other nanotechnologies, particles, along with the dialysis and radiology procedures and that also.
Okay, to be honest, I am not that much into that area, but I was having a fellowship who was working, who was doing also his PhD, and he was working on a kidney on chip.
Yes.
I didn't get the idea of that not that much, but I believe that it works basically to simulate the different. He was looking for specific transporters actually,
Yes.
and I didn't really get the idea of that one because maybe I did not explore it enough. Actually, this area is a huge area as well, and I did not really explore that much. But I know that in Manchester, for example, and in Glasgow and other areas, Bradford and in Cambridge, they are doing a lot of work in nanotechnologies and nanoparticles and all of these things. But honestly, that is not my area.
Actually, I am a member of the Microbiological Society of India. Nowadays, we are collecting all the information and lots of parameters going on the kidneys and the ventricular news. That's why sometimes the problem is there. Whenever it is going on the dialysis procedure or in the cancer of the prostate, you may know that is the only one drug, that is the hormone that converts into the amount of the water or the impurities. That's why.
See, there was an idea. My supervisor during my PhD, he wanted me actually to explore what is happening to the drugs before dialysis and after dialysis. But unfortunately, because of the time, and my PhD also came in the middle of COVID, so I ended up not going into that. But I remember him, he said that this is really also a growing area, and they wanted to explore because of the different things that happens after dialysis, I believe. So they don't know how to just also do it, and it's really an area for research. It's a good area of research because
As a pharmacovigilance teacher, I have a small idea about that. In these models, can you predict the drug-drug interactions?
Yes.
And what kind of drug-drug interactions and how we have to overcome and what is the drug optimization for each?
So it depends again on the. I remember when I was with my colleagues in Manchester University, they had a lot of drug-drug interactions, antibiotics and antifungal. And you know, sometimes these are the substrates even used to study actually the inhibitions and how it happens and things like that. So ketoconazole, I think one of them, and can't remember, but usually they will sit a substrate that would be the drug, and then there is a victim drug in the modeling software itself. And of course, you will have to have the data with you. So how much inhibition, everything, you will have to fit it in that software or interface. Actually, I would have, it would be a great idea to show you how sensitive looks actually, but you can explore it by yourself, by the way, it's available by So in that interface, you can feed in all of these parameters of the different drug, and you can run the simulation. Of course, you can choose the population, whether you want to run it in healthy or software, any other population, and then you can see how much of that drug is inhibited because of the drug. Even the fraction it applies, all of these data, it can actually show it to you. As long as you have it as a data and they are validated, then you can just run the simulation very easy and you can figure out if there is any drug-drug interaction actually.
Thank you.
If anyone have a question, please raise your hand. Students, please ask the question.
Good afternoon, ma'am. Actually, thank you for the informative sessions. My question is about non-linear effects. Is this model is capable of fully capture the non-linear effects? Like we can say that saturation of enzymes or something transporters.
See, with the non-linear kinetics, it's one of the difficult area actually, and you cannot really predict it. But the one that comes into my mind actually, phenytoin, probably, right? Okay, so this is really the concentration is never predictable, and you cannot really know. Still, there is a room as long as I said, the data here is very important for any simulation. As long as your data is good enough to be fed actually to the model, then whatever you are predicting, it can be used. But again, you have to run many times until you ensure that it is really a valid model to be used or to be applied to other population or other circumstances.
Okay, thank you.
You're welcome.
Hello, ma'am. Ma'am, in one of your slides, you had mentioned about it altering liver architecture or heart architecture. How does PBPK model affect the organ's architecture?
You know that the size, the volume, and everything else actually, whenever you are transplanting, everything changes actually in that organ. So, of course, the blood volume, for example, the blood flow, everything in that terms, it will change. So how does that impact the PK parameters? We need to figure it out. And all of these are already, by the way, studied and very well known in many of the literature. You can find them very easily. We grab actually most of the data from one study, the MDRD, for example, for the transplant, for the chronic kidney disease patient. So once you have, I'm coming back again to the huge message here. The data are very important. The source of the data is very important. So these changes definitely will make a change in the drug behavior. You will not say, you cannot really assume that there is no change at all. You know, when I was studying my protein binding, one of the theories that came along that actually the uremic toxins, the toxins that circulate in chronic kidney disease, does affect the molecule of albumin. It affects it in a way that even the subunits where the drug have to bind, okay, it doesn't really bind because of the reduced affinity and because of the changes that happens to that molecule. So all of these things you really have to look into it, and you have to basically integrate it in your model. You cannot just assume that there is no change and you apply the normal assumptions that we have or that are applicable to healthy subjects. Other questions?
If anybody is having question, please raise your hand. Sorry to interrupt you, ma'am. Now I request respected Joel sir to felicitate Dr. Ganesh Khare Patil sir, life member, Microbiological Society of India, NCL Junior Scientist. Thank you, ma'am. Thank you so much for this wonderful session, for sharing your valuable expertise. It was a very informative session. We would like to present a very much thanks to you. Patil sir to felicitate Ashok Murumkar, Kai Santa News. Patil sir to felicitate Vishal Gulab sir, Divya Marathi. Thank you so much, sir. Dear participants, for the next session, attendees are welcome for the lunch break. Lunch will be served at the ground in front of auditorium hall. Please note that after the lunch break, means at exactly 1:45 p.m., we will have our second lecture by Dr. Muhammad Ishaq sir. All participants are requested, please stay here. The first guest will go, then you can go. All participants are requested, please stay here. All participants note that your posters must be attached at the IUPSR building for poster presentation. All poster presenters are requested to attach your posters at IUPSR building for poster presentation. Our volunteers will guide you. If you have any query, please be free to ask them. All participants please note that our next session will be exactly at 1:45 p.m.
Let's have